Okay, so I think, I don't remember if we did this, but kind of clarifying a few words, right? Because they all kind of sound the same, right? Filtration, secretion, or absorption.
I'm confused.
Yeah, no, that's fine. So, all right, so filtration is when we're going from the glomerulus to the nephron, right? So we're taking stuff from the blood, the liquid portion of the blood, and filtering it into the nephron, right? So this is going from, let's see if I can spell this, glomerulus into the nephron. Okay. So that's filtration. That's like the initial separation of the blood and the liquid portion that you're wanting to go through the kidney. Okay. Okay. Absorption is when you take fluid or things from the nephron and put it back into the blood. Right? So we're going from the nephron back into the blood. And then secretion is basically the opposite. We're taking things from the blood slash interstitial space and putting it back into the nephron.
Is there a difference between excretion and secretion?
Yeah, I'm not sure. When I think of excretion, I think of more like, well, yeah, well, but I think they're probably used interchangeably, secretion and excretion, because both are the things that you secrete are the things that are going to eventually leave the body, right? If you're putting it into the nephron, aside from filtration, because it's a little bit different, but when you're secreting things into the nephron, you're wanting to get rid of them, basically, right? And when you're absorbing things, you're wanting to retain those things, like water and different ions and stuff like that. And so when you're going through the kidneys, this is primarily happening at like Bowman's capsule, right? So that first part. And then these other two are happening throughout. And different types of absorption and secretion are happening in different areas, but this is kind of constantly going throughout the rest of the nephron, right? Like for example, in the proximal convoluted tubule, we're absorbing a lot of things that were filtered, like glucose, water, some ions and stuff like that, right? But then when we go to the loop of Henle, right, we're getting rid of water, so out of the filtrate. So we're absorbing water, but then we're secreting ions and stuff, right? Because we're concentrating the filtrate. But then when we go back up, we're absorbing ions and stuff, right? And then in the distal convoluted tubule, there's secretion of like hydrogen ion and potassium and stuff. And then as it's going through the collecting duct, if ADH is not present, it'll just leave the body. But if ADH is present, then you absorb or reabsorb more water. Right? So sometimes they also call this reabsorption, because technically you filtered all of it, and so you're going to absorb it again, right? Mm-hmm. So yeah, you might see absorption or reabsorption, or you might see secretion or excretion thing. So, boom. To kind of clarify
Yeah.
the difference between the two. Yeah.